Okay.
Hello, Trina Becksted here. I'm with Holistic Healing News. Our guest today is Dr. Shuvendu Sen. He's a doctor of internal medicine. Are you in New Jersey, Dr. Sen? Is that where you are today?
Yes. Yeah.
Right.
I mean, I commute from New York to New Jersey, though my permanent house is in New York, but my hospital is in New Jersey.
All right, great, thank you. We're here to talk about, I'm hoping that we can see this book, Your Fabulous Provocative Title is What Got Through the Clutter. We get so many media pitches and a lot on yoga and meditation, not as many on Alzheimer's, and we know that you're an authority, and we're so grateful to have you and to share your information with our audience. You know, it was interesting because back in the 1980s, when we first really became aware, at least in the United States, of this disease, it was attributed to Teflon. Everyone was having Teflon in their bloodstream, and that was causing this. Well, now, fast forward, where we knew half of the population 15 years ago was over the age of 50 in the U.S., and now, what is the statistic that you're using in the U.S. and why it's going to be so monumental and actually, sadly, so many cases of Alzheimer's?
I'm happy that you asked this question. First of all, thank you very much for the invite. From the statistical point of view, we say about 20 million people are affected. But those numbers are possibly not the true reflection of the depth of the disease. The reason being, recent literature has been very clear in saying that even caregivers who are taking care of Alzheimer's patients, they are getting affected with the Alzheimer's. Now, the easy part is that it's an emotional thing, which you're taking care of your spouse or your brother or your sister. But from the scientific point of view, there was a good number of research that was conducted in Norway, in Europe, as also in Brazil, which actually says that those exact areas of the brain which gets affected in Alzheimer's, namely the left hippocampus, the prefrontal cortex, those areas of the brain have been found to be affected in the caregivers. So Alzheimer's is, in the current view on Alzheimer's is almost like an infectious disease, where if you are in close proximity to an Alzheimer's patient, and if you are taking care of the Alzheimer's patient, yes, there is an emotional quotient, which, you're obviously getting affected, you're depressed. But even from the scientific studies, we are finding out that those exact areas of the brain are getting affected. So when I say 10 million, 20 million, this is probably not even the tip of the iceberg. There is a huge amount. The whole society there's a tsunami that we think that's waiting in the corner.
I must ask you this. Now, you said emotional connection with these care and family members. Now, there's another word called empathy. And I'm wondering whether or not empathy, if someone is empathic, when someone is an empath, and typically someone who is connected that way or is a healer, we become empathic so we can carry the disease. So aside from the physiology or any kind of infection, I'm wondering when you say, emotional, is that also an empath thing?
I will agree with you. Growing literature is actually saying that you do get affected. Even when, when we see a patient, we tell, my residents, my students who are under me, I tell them that instead of sympathy, empathy is what is required. But even during empathy, whenever there is an emotional connection, it looks like that Alzheimer's gets transmitted. I'm not saying it's an infectious disease. I'm not saying there is a virus. We do not know all the answers. We're just scratching the surface. But the literature is overwhelming in saying that caregivers are getting affected with the same disease, which is a global crisis for us.
Indeed. Now, you talk about preventative measures in your book. And again, that title, I want to quote it directly, Why Buddha Never Had Alzheimer's. And you are talking about the use of yoga, meditation, dance, and music therapy. We've known for years that people with Alzheimer's, if they listen to music, say they're in their 80s or 90s, even 70s, and they're listening to music from the 1940s, that brings them out. So there's something in. Is that effective? That audio state, is that going to be a reason that they can go in their memory banks? Is that part of the frontal lobe? I mean, how are they effective with music?
if you're talking about music, there have been many literature, many research that has been done where music as the primordial language, for some reason, it brings up the memory, those exact areas of the brain which gets affected in Alzheimer's. Those areas of the brain get, in a very positive way, affected by memory. I'll give you a personal example of what happened in my life before I go giving you all the details that I can give all the research work that's done in the other universities. So I was a resident then. I'm talking about many years back, and I got a call from my nurse. I was in ICU that one of my patients is having shortness of breath. So I entered the room, and just to maintain the privacy of the patient, let me change her name to Gloria. And I found Gloria was in a state of semi-coma, and she had AIDS. And I realized that she was having shortness of breath because she was having a lot of fluid in her belly, and that was pushing the lungs. So I realized that the way to decrease her shortness of breath, I would have to take the fluid off the belly. So I prepared myself, I suited myself up, and I left my cell phone at the corner, but in that rush, I forgot to mute the cell phone. And as it would happen, I was about to draw the fluid. And there was no question of asking any permission from the patient because the patient was in a state of a semi-coma. Somebody called me during that time. That night happened to be a very special night. It was 24th of December. And I had changed the tune of my cell phone to Joy to the World the Lord Hath Done. And it started to play. And I was helpless because it was far away. And then from the corner of my eyes, I noticed Gloria, who was in a state of semi-coma. Her eyelashes started to flutter, and then her eyes half opened, and then she whispered, "Is it Christmas, Doc?" I said, "It is Christmas, Gloria." And then she said, "Merry Christmas, Doc." I said, "Merry Christmas, Gloria." The music stopped. The phone died. She went back to her coma, and I proceeded with my proceedings. So this is the reach of music. Music has the ability to go into the core of the brain, and research has been overwhelming in Europe as also in this country, where they have seen that music of one's choice, if played appropriately, it has the capability and the power to go into the deepest core of the brain. And in fact, it has been found from University of Pennsylvania that Western classical music can actually follow the exact pathway where Alzheimer's affects. And again, the amygdala, the left frontal cortex, the left hippocampus, and those are the areas. So, yes, so music does help in preventing or in increasing the reserves of the brain in those areas where Alzheimer's gets hit.
When you talk about prevention, so ideally, based, on the premise of your book, if people were meditating more, either transcendental with some kind of mantra or yoga and even some dance therapy, that could be preventative. However, you even mentioned reversing it. So is it true? I mean, could we get someone, if they are maybe in the early stages of Alzheimer's, to focus enough and do meditation and do some yoga, and you think that you can produce results?
Yes. And not only I think in a lot of my patients, see the very early stage of Alzheimer's, we have a name for it. We call it MCI, mild cognitive impairment. In mild cognitive impairment, you can still have a functional life. When we run a typical test, which we call as an MMSE, Mini Mental Status Examination, then we can find out that the patient is lagging behind. But Alzheimer's in a very early stage is very subtle. In the stage of MCI, mild cognitive impairment, one will know exactly where the bathroom is. One will know how to start a car. But what happens is that it comes in a very subtle and a very slender way. I'll give you an example. The person who knows what to have for breakfast, let's say he would order an omelette, a juice, a toast, he will forget those words. But he will say, "I need my breakfast." So the very fact that he says, "need my breakfast," I need my breakfast is a perfectly legitimate word. And that escapes the attention of the family. But all this while, this is the beginning of Alzheimer's. So what we are trying to say, what the scientists are trying to say, now that we have overwhelming evidence coming up from some of the best universities like in Harvard University, Johns Hopkins, and Yale, and I'm in touch with those researchers who are doing there, that meditation actually causes what we call as neuroplasticity. Neuroplasticity means that, that where, it can increase the neuronal connections. Then we are saying, why don't we start at an early stage before Alzheimer's becomes an Alzheimer's? Why don't we start when we are at the early stages, what we call as an MCI? Or for you and me, when it is not even MCI. Or for a caregiver who is always at the risk of getting it. It is there where meditation and yoga can become priceless. I'm not going against medication. I myself am a mainstream, medicine doctor. I prescribe medication. But you and I, we know that not all drugs are angels in the sky. They have their own sweet side effects. This is one holistic measure, meditation and yoga, which absolutely doesn't have an adverse effect and can be used as a great preventive measure.
Wonderful to know. With all the onslaught of these bioidentical hormones, and I know since you're in internal medicine, you probably know a lot about endocrinology, what effect will they have in preventing? Because a lot of people do, like the progesterone and DHEA and, estrogen replacement, testosterone. So if people are keeping, their hormonal balance, is that a way to do prevention as well?
Well, there has been research on the hormonal balance, and we think that, yes, why not? Because you can look into it, in terms of having a depression, in terms of having a bipolar disease, in terms of having any cognitive disorders, we are looking at neurotransmitters. So these neurotransmitters are chemical substances, almost like hormones. They are right there up in our brain, in various areas of the brain scattered. And the balance of these neurotransmitters are required to create the balance of our mind, which is much more than the brain. So yes, to an extent, and I have seen in cases of meditation, there have been clear indication that whatever the type of meditation is, as you mentioned, transcendental meditation or mindfulness meditation, whatever you want to do, there is a sharp decline in cortisol level. That steroid hormone, which actually picks up during stress. And in many cases, stress is a point of entry. Whether it's an Alzheimer's disease or many other cognitive disorders, we have figured out that all the risk factors that we talk about, whether it is high blood pressure or obesity or diabetes, stress actually is, the king of all. And that has been the point of entry for Alzheimer's disease also. In stress, it's the cortisol hormone that gets spiked. It has been found that both in meditation and in some yoga asanas and postures that we do, there is a sharp decline in the steroid level, which is an indication that the stress level is completely taken care of. And it is the triumph over stress which has been the greatest benefit of meditation.
It's interesting to note, we've worked a lot with doctors, and obviously since we are a holistic publication, we've worked with more, naturopaths or integrative, we've spent time at A4M, American Academy of Anti-Aging Medicine, and we were told that, some of the brightest thinkers, the female executive who was used to juggling, family and, white papers and just extremely busy, she wasn't more inclined once she stopped some of her work or even in the midst of it to contract Alzheimer's. So it is stress related. I was going to ask, we know that, Teflon, and we did away with the Teflon pan. What other factors? I mean, we know it's an age-related disease. We know that it's stress, triggered by a lot of stress. Is there anything else? Is there genetic code? With all this gene editing that we're hearing about, is there a way to just go in and edit it out?
Very right. I mean, there is one fraction of Alzheimer's which we know is related from the genetics point of view. But that's only probably about 10% of the case, where one tends to get Alzheimer's at a much younger age, and that Alzheimer's tends to be very aggressive. And we have picked up those genes, and we are working on that. But a major portion, almost 90% of the Alzheimer's, the risk factors, to be honest with you, we are not certain. Which is why we have different types of rules and regulations and hypotheses and guidelines that are born and they die within a week. Because we really do not know. We are really scratching the surface when it comes to Alzheimer's. It's a much more profound disease, if I may use the word profound for the disease, than a depression or a bipolar or schizophrenia, which is kind of like unipolar. Alzheimer's repertoire is so limitless, and it can begin with anything. It doesn't have to begin with, I don't know where my bathroom is. As a matter of fact, that's right at the end of it. As I said, word finding, difficulty in finding words is one way of, starting Alzheimer's. Absence of smell or difference in smell, that is another way. Sleep disorders is another way. Seizure disorder is another way. Depression is another way of starting Alzheimer's. So Alzheimer's can start in many different ways. So to answer to a question as to what are the risk factors which can precipitate an Alzheimer's, we do not have an answer, but we do know that stress is a very important part. Hypertension, high blood pressure, has been found to be related to Alzheimer's. Diabetes has been found to be related to Alzheimer's. High cholesterol has been found to be related to Alzheimer's. And if you look at it, if we look into Alzheimer's as an inflammatory disorders, and we look into heart attack as an inflammatory disorders, all those risk factors for a heart attack have been found to be the risk factors for Alzheimer's. But can you and I say for sure that high blood pressure causes Alzheimer's? Certainly not, because I have tons and tons of patients with high blood pressure who did not get Alzheimer's. There's obviously something more than high blood pressure, more than high cholesterol, more than diabetes which does that. Maybe it's a combination of all three of them, but we certainly believe that stress has been the major underlying cause of this Alzheimer's disease. I have come across patients with diabetes who have same number of bad numbers, same bad sugar numbers, hemoglobin A1C. I have seen one of them to be very quiet, in complete control, meditates, is a school teacher, and the other was a very aggressive businessman. Both these patients come to my office with the same number, same type of numbers. One of them is having a healthy life, the other crashed into a kidney failure. And when I look into their lifestyle, the only difference that I can find between the two is the stress level. So when it comes to Alzheimer's, we strongly believe that stress, and stress doesn't have to be the stress that something which is visible. A lot of us are internally stressed. It doesn't have to be a hair-tearing kind of an event. We internalize a lot of our tension, which is even worse. Which is why I encourage all of my patients, and I've been doing this even during COVID times, and so many of my patients were stressed out. The family members were stressed out. They were not even, by policy, we were not even allowing them to come to the hospital. And they were very stressed out. So when I'm telling them, and I'm calling them, and I'm telling them, it's a good opportunity for you to meditate. And it's not a complex exercise. You don't have to sit in a lotus position or Buddha. You can be seated in a comfortable chair and just follow the pattern of your breathing. You breathe in and you breathe out. You breathe in and that itself is mindfulness meditation. Literature clearly says that itself can affect our brain, that can cause neuroplasticity, that can bring down the steroid level, that can affect those areas of the brain. So, a lot of my patients do follow. It's a mindset issue. Some patients don't want to do that. We are so used to the drugs. We want to, swallow a pill with half a glass of water. We used to do that. Because meditation is a process. We are not going to get the results tomorrow if you start today. You know that very well. But I think it is about time that all of us take meditation as a very serious avenue of healing. And we should start prescribing meditation.
Absolutely. And with that, I'm going to ask you one more question, and this has been fascinating. We do want to talk a little bit about, and we'll do that in another segment, about this infectious stage and this idea that someone could contract it who is a caregiver, because that is the first I've ever heard, and I do think that we need to expound on that at another time. But the last thing I wanted to ask you, since you know so much already about the brain, where is the mind? Where does the mind reside? Is that the soul thing? Is that in the pineal gland? I know Candace Pert, the late Candace Pert, talked a little bit about some of these, the esoteric nature of the mind. I mean, do we know where the mind is? Tell me a little bit about that, please.
I honestly don't think that there is a structural location of the mind. I do think that, once EEG was established, electroencephalogram, we know that there are various waves in the brain. We have an alpha wave, we have a beta, we have a delta, we have a theta. And we find when our mind is in a tranquil state, there is a plethora of alpha waves. When our mind is in a very excited state, there is a plethora of beta waves. And there are ways that we can control the waves. I can have an inward journey, which is again back to meditation, what we call as the inward contemplation, our inward journey, where I can quieten all my energy and I can focus it onto one area. And it has been found that those who meditate, they have this high numbers of alpha waves, which kind of gives them the tranquil mind. So, if I'm pushed to the corner to say what mind is, I mean, the closest one can think of mind being related to any structure, it is a wave. And
this is what?
It's a wave. The various waves that we have, the alpha waves, the beta waves, that controls our mindset. And
very on and off switch? I mean, would you?
On and off, and this is something that we know can be controlled. Which is why we say that just like happiness, which is in our hands, tranquility, peace, contentment is also in our hands. And we can, instead of taking the external journey, while we are taking the external journey, we can take the internal journey, we can meditate, we can focus all our energy, and we can create these alpha waves, and we can be at peace with us.
And with that, I will say namaste. This has been fabulous. It's just a true gift for our readers and for me. So, thank you. Fabulous time. It was so nice to meet you. We hope to see you again and interview you more. Goodbye. God bless. Namaste.